Welcome to our channel. Today, we're diving into a topic that affects millions but often goes unnoticed: depression. But not just any depression. We're talking about the hidden and newly discovered signs that might surprise you. So, whether you're commuting, cooking, or just chilling, stick around. This is going to be enlightening. First up, let's talk about something we all do: sighing. You might think it's just a way to catch your breath or express frustration, but did you know it can be a hidden sign of depression? According to Dr. Rebecca Johnson from Psychology Today, frequent sighing and visible frustration are subtle indicators that something deeper might be going on. So, the next time you hear someone sighing a lot, maybe check in on them. Speaking of checking in, have you ever met someone who's always the life of the party, but something just feels off? This could be what researchers call forced happiness. It's a mask many people with hidden depression wear to blend in. Dr. Samantha Lee from Psych Central calls it smiling depression. These folks work extra hard to show the world they're okay, even when they're not. It's like wearing an emotional costume. Tricky, right? Now, let's dig into something we all experience, but might not link to depression: that is negative self-talk. Imagine you have a little critic in your head, always pointing out your flaws. Dr. Michael Adams from Medical News Today says persistent negative self-talk is a sneaky symptom of depression. It's like having a mean coach who never gives you a break. Here's one that might surprise you and is substance abuse. Sometimes, people with hidden depression turn to alcohol or drugs to cope. Dr. Emily Roberts from New Waters Recovery highlights that this behavior often makes the situation worse. So, it's not just about the substance, it's about what's driving the need for it. And now, for the social butterflies out there, listen up. If you or someone you know starts withdrawing from social activities, it could be a sign of hidden depression. According to Dr. Mark Williams from Healthline, a sudden desire to isolate can be a red flag. It's like that friend who used to be at every gathering but now prefers to stay home. Something might be up. Let's move to some newly discovered signs. Did you know that unexplained aches and pains can be linked to depression? Yup, you heard it right. Dr. Sarah Thompson from OBGYN Nebraska found that physical symptoms like these are often overlooked but are crucial indicators. So, if you're feeling sore for no reason, it might be worth looking into. And what about those changes in appetite and weight? Dr. John Harris from Medical News Today points out that sudden changes in eating habits, whether it's overeating or losing your appetite, can be a sign of depression. It's like your body's way of sending an SOS. Last but not least, let's talk sleep. Insomnia or sleeping too much can both be signs of depression. Dr. Lisa Carter from Ada Health emphasizes that these sleep disturbances are often primary indicators. So, if you're tossing and turning or hitting snooze all day, it might be more than just a rough week. There you have it. Hidden and newly discovered signs of depression. Remember, these signs can be subtle, but paying attention to them can make a world of difference. If you or someone you know is experiencing these symptoms, don't hesitate to seek professional help. And keep the conversation going. Mental health matters. Thanks for watching. Stay curious, stay compassionate, and see you next time.